So today we're going to be assessing my client's hip hike during a single leg squat. A hip hike is just when there's increased hip abduction on the opposite side of where that squat is being performed. As you can see, her left hip is abducted. This could be due to the quadratus lumborum, TFL, or glute minimus being overactive. It can also be due to the adductors and glute minimus being underactive. Range of motion tests and manual muscle tests were performed. The range of motion test showed that the TFL and glute minimus could be the cause of these impairments. The manual muscle test also confirmed that TFL is overactive and the glute medius is underactive. This could just be this is just causing that TFL being overactive is causing that left hip to be pulled up into that increased abduction, creating the hip hike, and the underactive right glute med is allowing for that overactive muscle to pull that hip into the hip hike position.
All right, so first up, we're gonna work on that overactive left TFL muscle. We're gonna do this by SMR techniques. We're gonna use a foam roller on that left TFL. We're going to complete one set of this activity. All we're gonna do is we're gonna place that TFL muscle right on that foam roller with that left leg straight out behind you, with that right leg crossover in front of that leg. We're gonna lean down on that elbow and we're gonna roll back and forth on that TFL muscle. And we're just gonna hold we're gonna do this for 30 to 90 seconds, holding on those tight, tender spots. Just SMR is designed to alleviate those overactive trigger points. And I chose this form of SMR foam rolling because foam rollers are easy to use, relatively inexpensive, and a good way to just release those overactive muscles. Some contraindications for the SMR can include osteoporosis, blood clots, and healing fractures, just because this pressure on the foam roller will add to those injuries or impairments.
The thing we're going to do is our lengthening exercise. The lengthening technique for the TFL that we're going to do is you're just going to stand on your right leg. You're going to pull that left leg up, grab onto that ankle, and allow for that knee to relax. We're going to hold this position for 20 to 30 seconds, and then leaning into that lifted leg. This is going to bring that TFL into abduction and flexion. Some rationale for static stretching is it's going to release those muscle spindle fibers and allow for that muscle to lengthen. So once you finish holding this position for those 20 to 30 seconds, you're going to repeat that 2 more times for a total of 3 times. And then some contradictions for this static stretching are acute injury, rheumatoid arthritis, and osteoporosis.
Next exercise, we're gonna work on that underactive glute med. Our next exercise is going to be our isolated strengthening technique. For this technique, we're going to perform a lying leg raise, lateral leg raise. To do this, we're gonna lay on that left side, so that underactive right glute med is being worked. We're going to, so we're just gonna lay on our side with our knee bent like this to provide stability, and we're just going to abduct that right leg into the air, activating that glute med. We're gonna perform 3 sets of 10 to 15 reps, making sure that the movement is slow and controlled so that we're doing it correctly. These isolated strengthening techniques are designed to increase force production and isolate those muscles that are underactive. Some contraindications to these movements are injury, arthritis, impaired joint movement, or pain.
Final exercise, we're going to be completing our integrated dynamic movement. For this exercise, we're going to still continue to work that weak underactive glute med. We're going to perform lateral lunges. So in order to perform a lateral lunge, you just abduct that right leg,
get in a wide stance and lean into that right leg. You're gonna perform 3 sets of 10 to 15 reps, making sure that movement is slow and controlled. The purpose of these dynamic movements are to enhance functional capacity of the whole human movement system by increasing the neuromuscular control. The dynamic movements are also going to increase that intermuscular coordination, which is just your body's ability to work all your muscles together properly. A few contraindications for the dynamic movements are injury, rheumatoid arthritis, joint pain, joint injury, etc. You're going to want to make sure to complete this entire program 3 to 5 times a week. Make sure that you're being consistent with this program to help those overactive and underactive muscles.